I have COVID.
Nina Martin documented her battle with COVID-19.
I chose not to have the vaccine.
The Bakersfield woman shared her story.
That's so good.
I can't lose another person the way I lost my sister.
17's Alex Fisher shares the meaningful message Nina left for all of us.
And what was I thinking?
It's okay to admit maybe I was wrong.
In her own words, Nina's message, Wednesday on 17 News at 5.
Should have definitely got that vaccine.
Nina Martin loved her family. A couple times a year, she and her 3 sisters planned a getaway.
We would go to the mountains, we'd go to the beach, we would go to Hawaii, we would just do crazy things.
This summer, Nina was excited when things were opening back up.
She went to baseball games.
She was a huge San Francisco Giants fan. She even went to a game last month.
I think we're the first ones here.
The worst of the pandemic seemed to be in the past. So she thought. But her family worried. In June, Nina's sister texted, nagging her to get the vaccine. Nina responded, "I don't need it. I just don't want to get it. There's no reason for me."
She did not have any underlying issues. She was healthy, she was active, she was always out doing things. She was not overweight, she did not have those issues, which I think is part of the reason she didn't feel it was necessary for her to be vaccinated.
She was wrong, as became clear on July 24th when she tested positive for coronavirus.
So, I have COVID. I'm in the hospital.
She called me and said, "Sis, I tested positive, but I'm going to be fine."
She wasn't fine.
And no, I didn't get the vaccine.
Because of the infectious nature of COVID, she was in isolation, unable to have visitors.
Within a few days, she rapidly got worse.
COVID quickly wreaked havoc on her body.
She was in the hospital alone from August 1st. Her body continued to go down that whole time. And there was nothing that was wrong with her to cause that. It was the COVID that was attacking her.
Hooked up in the hospital and attached to different machines, Nina realized she needed the vaccine, but she knew it was too late.
Should have definitely got that vaccine.
Nina's intense battle with COVID illustrated in the heartbreaking text to her loved ones. She texted her dad one day saying, "I'm suffocating." Her father texting back, "Just keep breathing. You're a fighter and you're strong. Just keep up the good fight. Love you, my sweet Nina."
I literally watched my sister over a 20-day period of time die, and she drowned in her lungs. She would call me on FaceTime, struggling for her next breath. She would text me saying, "Sissy, I'm afraid I'm going to die. Please take care of my children."
Early on August 14th, Nina took her final breath. She died alone in the hospital. Just 1 month ago, the sisters had been planning another girls' trip. Now, they're planning a funeral instead.
I just don't want other families to feel what we're feeling right now, because the pain is so immense that it's hard to explain.
Pain the family is afraid others will feel because so many are still unvaccinated.
Anyway, I love you. Pride comes before your downfall. You may have been telling everybody not to get vaccinated. You don't need to get vaccinated. This isn't going to impact you. And so in your heart, you've believed that. Don't let that cause your death. Don't let that cause the death of one of your loved ones. It's okay to admit, maybe I was wrong.
Her family is hoping their tragedy will show this virus doesn't kill only those with underlying conditions. It's also killing otherwise perfectly healthy people, and it's mostly preventable.
Healthy mothers and fathers out there with young children, this could and will affect you. This is serious. Don't be prideful about this. You don't even have to tell anybody. Just go down to the drugstore, walk in, and you can get vaccinated today.
This is a special edition of 17 News. Pandemic, the Kern County impact, 1 year later.
Well, for weeks now, we've been talking about the increase in cases in Kern County and what's being called this second surge. Our hospitals are filling up fast, And models show more people are going to get sick and die unless drastic measures are taken to reduce the spread. Now, here's a look at the increase in hospitalizations. You can see here's the first increase. Now we're starting the second increase. We're showing more people are getting sick here in Kern County. And here's the reason why this is concerning, because we are in the middle of what could be a much bigger surge than what we experienced here during the summer months, and Kern County could be in more trouble than other counties since we have one of the highest percentages in the state for people at risk. Let's take a look at that percentage right here, and you can see that 45.8% of people in Kern County are at risk for coronavirus complications.
As cases rack up, about 1 in every 11 people in Kern has contracted the virus. And every case is more than a statistic. It's a person, a friend, a loved one, including a beloved local choir teacher who recently shared his experience with the community. I caught up with Kenneth Wichert earlier this week as he continues his recovery.
I'm sorry, I just have to catch my breath a little bit.
His voice is his instrument, but Kenneth Wichert found it difficult to string a sentence together just a few weeks ago.
17's Alex Fisher continues his ongoing examination of COVID-19, taking you inside a Bakersfield hospital, inside the COVID unit, where local doctors and nurses battle the deadly virus. The raw impact of COVID-19, tonight on 17 News at 5.
I want to ask you about the vaccine. You said you wish you would have taken it.
I guess I didn't take it as seriously as I should have.
This virus is not the same that it was a year ago.
Our patients are sicker. This is an ugly, ugly enemy that we can't see.
It's taken a toll on us all emotionally.
Vaccination is the most effective, safest defense that we have.
What we're seeing now is a pandemic of the unvaccinated.
Down this hallway are 30 beds. All but 2 are filled with very sick patients with COVID-19. Each of them in their room hooked up to oxygen, struggling to breathe.
No one is safe from this virus.
There's a few practices I probably should have kept, but I didn't.
For those who recover, there's still damage.
Yeah, we're calling it long haulers disease. The people in ICU or the hospital that make it, their lungs are in really bad shape, and so there's going to be some scar tissue that's going to impact them probably for the rest of their life.
Here in the ICU, there are 8 beds. 7 of them are filled with COVID-positive patients, all of them sedated and clinging onto life. The youngest is just 40 years old.
We can't stop these senseless deaths.
We've had 20-year-olds die at our facility. They're healthy, they look good, and they just cannot get oxygen in their lungs.
I don't even know how many deaths that I've seen. I can't even count on 2 hands.
We had a 30-year-old last week that had his first baby newborn. Right before he was intubated, he got to see his baby on FaceTime with his wife. Never met his baby in person. That night, he passed away. So this is how serious this is.
I can't communicate via an iPad the emotion of how sorry I am that there's nothing we can do to save your mom's life, your brother's life. No one should have to go through that. And because of this virus, families, they're dying like this, left and right. I just want people to know that when their family members are here and they can't come see them, that we do uphold their dignity. They're not a number. They have a first and last name.
The amount of death has always been too much for frontline workers.
We are tired. The staff are very tired, and the doctors are very tired. But we have to press on.
But this third wave is proving to be more difficult for nurses, as it takes a toll on their well-being, trying to help patients stay alive when this pandemic could have been behind us.
It is an emotional roller coaster.
I know myself, I'm probably not taking the best care of myself.
It just is really frustrating for me to hear people just say COVID is kind of a made up, we're making a big deal of it. It's really not that big of a deal.
It's beyond comprehension that somebody could think this is not something to worry about.
We are really frustrated because it's something that can be preventable, that can be taken care of. If everybody would have jumped on and get vaccinated, we will have maybe like 2 or 3 patients with COVID on this floor.
Hooked up to these machines and sedated in this bed. This is where a lot of patients sick with coronavirus took their last breath.
You think of your immune system as an army, right? You have a whole army and they can go fight a war, but if they haven't been constantly trained, they are not your best soldiers. So same thing with the immune system. Once you have a vaccine, your immune system is ready. It's like an army that is ready to go to war. So the moment your body gets exposed to the virus, your body is ready to fight.
I'm one of those who I was anti-vax, and now this has turned everything around.
This is a special edition of 17 News, the COVID Town Hall. Now, here's Maddie Jansen and Alex Fisher.
Tonight, a crisis looms as coronavirus cases skyrocket in Kern County. Good evening, I'm Alex Fisher.
And I'm Maddie Jansen. Tonight, our top story is the same as it has been for months now. Our community is in the middle of the darkest days of this pandemic so far, and there's no sign of slowing.
It appears the numbers continue to be high, as you can see. A vast majority of people who contract this virus do recover, but our hospitals, as you can see, are filling, and they're quickly filling up, and resources are running thin. So here's a look at the number of hospitalizations, and you can see that we are at the worst days so far through this pandemic. And as more people get sick, more people end up in the hospital and ICU. I want to begin with you. We just heard about our hospitalizations here in Kern County. We just saw what it looks like on the front lines. We've seen the numbers. Where are we in this pandemic right now, and what does the situation look like as of today?
Well, unfortunately, we're still seeing some high numbers.
We're going to be talking about vaccines. A lot of new developments over the last 24 hours. When you'll be able to get a shot in the arm coming up a little bit later this evening. We're back in 2 minutes.
17 News Town Hall.
Good evening, and thanks for joining us for a special edition of 17 News. I'm Moses Small, and tonight we're talking about COVID-19 in communities of color. Less than half of Black Americans said they wanted a vaccine, and that inspired this panel discussion because the whole community needs to work together to wipe out the virus. And then that brings us to our panelists today, all African Americans in our community with a range of experiences with the disease.
If a picture could tell you just how difficult the last 52 weeks have been for local businesses, this picture would be it here at the Giovanni's Italian Eatery in Shafter. The owner here tells me it's been one tough year. Noi Suche has owned Giovanni's for 15 years, but this year has tested her and her business in more ways than she could have ever imagined.
It's been very challenging, very difficult. It's been very sad also.
Sad, she says, because pre-pandemic, her restaurant was booming with patrons. Now, the chairs and tables inside sit empty.
May I have your name, please?
Like many business owners, Suche has transitioned to to-go orders, but for much of the year, that was not enough to keep her business going. Giovanni's nearly went under.
It was getting really bad for us financially. We thought we couldn't make it, and then a lot of times we were thinking about closing, but then I've been thinking to myself, like we have a lot of supports from the community, and they tell us to hang in there, keep going, keep going. I guess that's what motivates me to stay open.
For the foreseeable future, Giovanni's will continue to do only curbside, takeout, and delivery. And as you can imagine, over the last year, they've certainly gone through their fair share of to-go pizza boxes. But the owner here tells me she's hopeful over the next 52 weeks they'll see fewer of these and eventually more of you here to dine in. In Shafter, Eitan Wallace, 17 News.
Julie DePietro is 52 years old. She's been a nurse practitioner for nearly 25 years, and for the past year, like so many other nurses, she has been a frontline soldier in the war against coronavirus.
This is what I do, this is what I love, and I'm just going to keep doing it and helping others.
That worried her kids.
That was hard to sit back and see her get so ill, trying to save other people. No one ever thinks it's going to happen to them or to their family member. And for us, it did, and it's been very severe, and we hope that we get to have more memories with her.
The disease caught up to Julie right before Christmas. She was in the ICU for 4 days. She rallied, was released, and went home. January 2nd was her birthday. On that day, she was found on the floor of her home, unconscious. She's been in the ICU, in a coma, on a ventilator ever since. Her kids describe her as spunky, with a wicked sense of humor, the life of the party. They said she is the kind of person who would give you the shirt off of her back. But she had an autoimmune disorder. It made her more susceptible to the virus.
It's been pretty tough because, no one's ready for this when it happens. And
She's been fighting coronavirus infection and pneumonia all at the same time.
I haven't heard her voice since New Year's Eve. And even then she was a little confused and she told me, I didn't even know it was New Year's Eve, and it was like 5 p.m. her time there.
Treatments like convalescent plasma and double red blood cell transfusions have helped her. Her kids decided they needed to help the cause and donate themselves.
If you can donate, you should go donate because it's very, very important. I mean, donation centers are really, really low right now. Hospitals are low. Especially if you have a really common blood type, get in there and donate. It's pretty easy.
It's especially important now. According to a spokesman for the Houchin Community Blood Bank, donations of convalescent plasma have declined dramatically because so many people think the pandemic is coming to an end. It's still very real for Julie's family.
Nobody is prepared for their parents to pass away or to get sick. It really shines a light on the people with underlying illnesses. And you do have to take care of those people because they're prone to stuff like this, and you might not realize it, but this is a eye-awakening experience for us. Our mom's pretty young,
and her kids are hoping to hug their mom once again. In Southwest Bakersfield, Nicole Gitsky, 17 News.
The deadly impact COVID-19 has on the world touches Kern County. As the Delta variant continues to spread, 17's Alex Fisher examines our local death toll. Have we done enough? And what can we expect? Kern's Deadliest Days, Wednesday on 17 News at 5.
Coronavirus was bloodthirsty as it preyed on our most vulnerable residents. For months, our health officials were like air raid sirens during a war, warning that COVID-19 was coming and it would show no mercy. We had time to practice and perfect the guidelines to save lives. Kern County didn't listen, and the virus emerged victorious like an enemy on the battlefield. Like an attack we knew was coming, and hundreds died. Families were torn apart, and the numbers show many people may have died because of the virus than what's being reported. These were Kern's deadliest days, and people are still dying.
Dodgers have won it all in 2020.
There was a lot to celebrate in 2020 for Daniel Miranda.
He was ecstatic, especially when it was both LA teams that he roots for. Like the Lakers had, won, and then right after that, the Dodgers came and did it. It was a good year for him when it came to sports.
2 months later, coronavirus snuck into Miranda's home like an unwelcome intruder. The outcome was deadly. Coronavirus hit Kern County like a once-in-a-century storm.
I've never seen the amount of devastation.
Our first case was confirmed in mid-March. 2 weeks later, our first death. It would be the start of an unimaginable challenge to our healthcare system.
I've never seen destruction like this. The damage that it does to their lungs and vascular system, it's incredible.
More than 8,000 people died in Kern County from all causes during the pandemic. Here are their death certificates. Each one describes in clinical, scientific terms how a human life ended. People died from suicide, homicide, car crashes, drug overdoses, but COVID-19 was the leading cause of death in Kern County. It even beat cancer. 1 in 6 death certificates in these 2 piles represents a COVID death. Through the California Public Records Act, we requested every death certificate during the first year of the pandemic. We also collected statistics on the total number of deaths over each of the past 5 years. What we found shows ebbs and flows every year. 2020 was no different at first, but as soon as coronavirus made an unwelcome entrance into our community, the trends changed. By the end of the year, total deaths were up 21% from the year prior. COVID was to blame.
Probably the biggest thing that stands out is how severely we can be affected and how quickly.
Prior to 2020, our deadliest August over the past 5 years was 2018, when 488 people died. In August 2020, 728 people died. 154 were coronavirus deaths. At the end of the summer, the virus loosened its grip, and it seemed the worst had passed. But health officials continued sounding the alarm.
This is a real threat to our community.
COVID is a fraud.
Kern didn't listen. People proudly defied the guidelines, urging them to stay home and slow the spread. Some mocked the severity of the virus. saying COVID-19 was no worse than the flu. They were wrong.
We should learn from the past.
Then, as medical experts predicted, coronavirus returned, and with vengeance. It preyed on our community and readied its attack and unleashed its fury. While families were preparing Thanksgiving turkeys, nurses were preparing extra hospital beds. Sure enough, a week after the holiday, a spike in cases. The worst day, December 9th, 13 days after Thanksgiving, a whopping 1,479 people tested positive for the virus. From asymptomatic cases to fatalities, the virus jumped from person to person. The deadliest days would soon arrive.
We in the ICU and in the hospital, as nurses, we were sitting there watching. We had those dates like marked on our calendars. We're like, these are the days we're going to start to get busy, because hospitalizations tend to peak about 10 days after the patient gets tests positive for coronavirus.
The virus's winter reign of terror lasted more than 2 months. The worst day, December 30th, when 20 people died from COVID-19. By mid-January, Kern was losing more than 90 lives a week to the virus.
And just seeing the kids watching their father as he's taking his last breath. And the mom is sitting in the room crying, telling him, your dad's dying. I still remember that night.
You know, not being able to be with your loved one, that's, I think, was the most heartbreaking. Most of the deaths were, you know, me holding a hand, families on FaceTime, saying goodbye, sometimes to patients, telling their children goodbye. They've had a great life, you know. That's hard.
The Miranda family knows that pain too well. Although they tried to do everything right, COVID entered their home in December, an unwelcome holiday visitor.
You know, my dad played all the right roles.
But as the cold winter days persisted, the family kept their heater on, and the virus spread through the air vents. Daniel tested positive Christmas Eve. By New Year's, he was in the hospital.
It's just so shocking to see your dad, the one person who's supposed to be the strong one, who's supposed to be there for you, who takes care of you, and he's just helpless and you can't take care of him.
Since visitors weren't allowed to wait in the hospital room, the family sat outside and waited.
And I would just wait outside his window. I'd pull a chair up with the blanket and just sit underneath his window waiting for him to come home.
On January 10th, the family received a phone call from the doctors. Daniel didn't make it, and his family wasn't able to be there when he passed.
He had to say goodbye through a glass. I wanted to go across his face, hug on him, kiss his lips.
It's a group effort. You know, we could be as safe as we were. We were as safe as can be, but because someone who wasn't as safe came into contact with us, unfortunately, it led to a domino effect that ended in someone else being taken from it.
Before the pandemic, about 16 people died each day in Kern County over the past 5 years. Coronavirus caused that number to go up to an average of 23 daily deaths. The data we collected showed January 2021, the peak of the pandemic, was the deadliest month in Kern County history.
I do believe that people underestimated it. And by the time we underestimated it, here we are.
The virus didn't just penalize the reckless or disbelieving. Since it was rapidly jumping from person to person, sometimes it still struck those who took precautions, in some cases with appalling unfairness. There is no more tragic example than that of the Longoria family.
This is my father, Israel Sr., and this is my brother, Rolando, known as Rolo, my brother, Abel, and my youngest brother, Renee.
Okay, Renee, how are the tamales? Very excellent. Riley, how are the tamales?
Israel Longoria Sr. and his wife Juanita, both in their early 80s, were cautious, as were their 5 sons. They stayed close to home, and on the rare occasion they would go out. 60-year-old Ernie Longoria was perhaps the most cautious. Masks, hand sanitizer, gloves. He took the coronavirus seriously. Then he got it. He recovered, but everyone else got sick with what turned out to be COVID-19. Everyone except the eldest, Israel Jr., a 61-year-old retired elementary school principal. who stayed home. But Israel's brother, Rolando, died December 22nd, his father December 31st, and then incredibly, his brothers Abel and Renee, just a few hours apart, on January 8th. The three brothers were all in their mid-50s.
It doesn't matter your race, it doesn't matter your gender, it doesn't matter whether you think you're healthy or not, whether you're in shape or not. It doesn't matter your political affiliation, my goodness sakes. It attacks everybody.
The day the Longoria brothers died was Kern's deadliest day, exactly 2 weeks after Christmas and a week after New Year's. 47 people died that day, 14 died of COVID-19. We found 1,004 people died from all causes January 2021, a 77% increase from the previous January. More than a third of all deaths for the month were COVID deaths. In the first 365 days of the pandemic, 1,331 people died from the virus in Kern County. That put our yearly total above normal, but more people died during the first year of the pandemic than in previous years, and there's no clear explanation for the increase. After you take away the COVID deaths, we found an additional 631 lives lost in the first year of the pandemic, and COVID was not listed as the cause of death. We looked at every death certificate. The only causes of deaths that we found that increased during the pandemic: homicides and deadly accidents. But statistically, those increases are minimal. They don't explain the spike in non-COVID deaths. Health officials say it is possible people who contracted COVID-19 and recovered died because of the effects of the virus. Because COVID wasn't in their system at the time of their death, it's possible the virus was not necessarily listed as an immediate cause of death.
There's a lot of conversation and a lot of research going into, what we call COVID long haulers, or the long-term sequelae we see after people have recovered from that acute infection. They have cleared the infection, they no longer have any virus circulating in their body, but damage has been done.
Damage that isn't repairable and could cause health problems, even death, years after the pandemic. That's why there's a rush to put an end to this disease. Now, with the Delta variant making frightening gains and much of the county choosing not to vaccinate, Longoria is worried that others like his family, those who continue to take precautions, could be vulnerable again.
To say that I don't believe in it, that it's a hoax after so many people that are dying, I'm angry at them because I believe it's them who caused my family to die. If they would have been more cautious, been more considerate, been more humane toward other humans, this wouldn't have happened. We could have done a whole lot better than this, but there were just too many people that just thought of it as a hoax, that it was no big deal, but it is a big deal.
In the first year, we found the average person who died from COVID-19 was 69 years and 357 days old. Our oldest victim was 101. The youngest victims were 19. These are the lives lost, not simple numbers. It's an uneasy feeling for families like the Mirandas to lose someone to COVID and know the virus could come back.
Yeah, we have a promising outlook. Doesn't mean that it's over with, and doesn't mean that the pain has gone away from those who lost people.
I can't do that again. It's not something I want to do again. I don't want to see someone I love go through that, and it's not something anyone should see their loved one go through when it's so easily preventable by just getting vaccinated.
And one day, when the virus is no longer on our minds and we return to normal, hundreds of families will forever deal with a new normal, one they never thought would exist.
I always ask God to take me first because I never wanted to feel this. My husband must have prayed a little harder.
Kern's deadliest days, a number eerily defined here at the Bakersfield Fox Theater. Each empty seat representing a life lost to COVID-19.